Singapore plans to build 3 new long-term psychiatric care facilities by 2030. It's also enlisting more polyclinics and family clinics to offer mental health services. And these are part of a new national strategy to ensure mental health care is accessible and effective for the people who need it. Sabrina Ng reports.
Maintaining a healthy mind can be a balancing act, whether young or old. But with mental disorders among the leading causes of mortality and ill health in Singapore, the challenge is in making sure available support can meet the growing need for care.
We want to increase the access and availability of services within the community, the professionalism and competencies of the staff and personnel, volunteers, social service agencies in the community, as well as then increase the capacity and capability of the professional healthcare services to deal with the entire spectrum of mental health and well-being.
Under the new National Mental Health and Wellbeing Strategy are plans to build 2 new long-term psychiatric nursing homes and a psychiatric rehabilitation home by 2030. There will also be more inpatient psychiatric beds and rehabilitation capacity at the Institute of Mental Health. For primary care, all new polyclinics should provide mental health services by the end of this decade. And there will be more family doctors enlisted to support mental health under the Healthier SG program.
We deal with a lot of chronic patients having had chronic diseases and developing complications in the later part of their life. A huge portion of them will develop mental health issues like stress, depression, anxiety, etc. Because we are the primary providers of care to them, we will be at the right place at the right time to pick up these mental health issues and provide timely care and appropriate referrals when needed.
At the community level, groups like social service agencies can provide counseling and psychological services.
Community-based social workers like us play an important role in detecting signs of psychological distress, providing coaching on coping strategies.
Distance may sometimes become a barrier for them to seek help. But once they are aware that there are such community services, I think the mental health services that is available near them, we hope that, through reducing the traveling time, it may be a further reduction of that barrier for them to seek help.
To consolidate efforts and oversee how the strategy rolls out, the Health Ministry is also setting up a National Mental Health Office by 2025. This will bring together officers from the health, education and social sectors in a nationwide effort to bolster mental health.
The National Mental Health Strategy goes beyond just treating mental disorders. It's also about preventing them. And to do that, the Health Ministry is directing more resources to promote mental well-being from an early age. There will be initiatives that build mental, social and emotional resilience in preschoolers. This adds to programs already available for students at critical transition years, like around their PSLE exams and O&A levels. The strategy also addresses social media and harmful online content. There will be a guide on using technology in a healthy and positive way and recommendations to reduce its negative impact. Recognizing the crucial role that parents play, a toolbox will also be available. That's starting next year. This will equip mums and dads with the tools to build strong parent-child relationships and help their children navigate mental health challenges. Last but not least, steps to improve mental well-being in the workplace and help individuals in recovery find meaningful jobs. For more on how this strategy could play out on the ground, we have 2 frontline practitioners in the studio with us. Portia Poh, Executive Director of Silver Ribbon Singapore.
And joining us over Zoom is Joseph Yeo. He's Director of the Children and Youth Services and Mental Health and Counselling Services at Care Corner Singapore. Welcome to the program, both of you. Let's start with the first question, and Mr. Yeo can take it first, followed by you, Portia. Your organizations have both given feedback in engagement sessions that went into crafting our national strategy. What, for you, each one separately, was the most important and most urgent priority? Let's start with you, Mr. Yeo.
Good evening, everyone. I think a recent study showed that 1 in 3 adolescents reported struggling with anxiety and depression. So for us, increasing the range of services available to the young people is very critical, as students in secondary schools or in schools may not prefer to engage their parents at the initial stage of seeking help. So while parental support remains an important part of the equation, allowing the adolescents access to services with relevant safeguards with accredited community agencies will be useful in improving their access to help. Secondly, there are also various community agencies providing support, but youth, while they have built a rapport with a certain professional, they tend to want to stick with them. So this is one issue that the tier care model will need to address. Having said that, it is important that we have a tier care model to right-side individuals, to provide them with the help in an effective manner, such that youth who only need basic emotional support can be helped in a very basic way, and we can extend more extensive support to those who really need it. Last but not least, the development of the competency framework allows social service agencies like ourselves to have a systematic process of recruiting and developing mental health professionals. It ensures quality care in a community setting, such that hospitals can step down individuals whose conditions have stabilized, and we can work with them in close partnership with schools and family support systems. So these are most critical for us.
No, right. Ms. Poh, we just heard Mr. Yeo there spell out, in essentially for him, prioritizing access, making sure adolescents get access to counselling. It includes things like continuity in terms of counselling, as if they get attached to one particular counsellor. For you, what have been your priorities?
In my opinion, according to SOS, the Samaritan of Singapore, they have announced that the suicide rate is quite high among the youth. So in my opinion, I agree with Joseph to focus on youth mental health and to encourage them to come forward and to speak out, even before they start speaking to a counsellor, just to speak out to at least somebody.
Portia, the national strategy, do you feel, I mean, looking at the details of it, that it's going to adequately address the challenges that we have?
I strongly believe so, and I'm glad that the government is paying attention to the feedback of the community and the social service agency. This is very encouraging, and I see that they are addressing youth, caregivers, parents, and all this targeted audience are really important. Thank you so much.
Joseph, what about you for the sort of adequacy of the national strategy? What are your thoughts on it?
Firstly, the national strategy on mental health is very important in improving the access and also to strengthen coordination among community and healthcare providers and to ensure the quality. So it's very heartening for me to see that the government is taking the lead to develop the strategy and to have a national office ready to coordinate the strategy and oversee the implementation. At the same time, while the government spearheads and take the lead to develop the strategy, it also emphasizes community engagement and support systems so that individuals and families have the resources they need to maintain their mental well-being in the community setting. So that, for me, is important.
So, Ms. Poh, Mr. Yeo speaks about the importance of coordinating different efforts. There is, of course, possibly the drawback. If you give your strategy, for example, offering help at so many levels, community, to hospital, and he was mentioning caregivers, parents, children, is there the risk that if it's so, I suppose, diffuse the efforts, you might lose out from the benefits of having a far more targeted, let's just look at this kind of anxiety that is typified, for example, in a certain group of students at a certain level of their development?
It's unless you are able to identify the needs of each individual, we start from reaching out to the community in general. And while doing so, we try to identify their needs before we customize the program and services according to their concern.
Joseph, you were talking about the increased need to communicate better with the youth, as an example, to give them more avenues for them to express their needs, their mental health needs, and so on. It might not be so easy for a preteen or a teenager to begin that journey. It might take the sort of participation of their parents, of their teachers, and so on, from the outset. How can you better facilitate the beginning of that conversation for younger people about their mental health journey?
I think the school ecosystem play a very important part. We have been partnering a lot of schools to give assembly talks so that there is an increased awareness of mental health issues. And we encourage them to talk to their teachers or the school counselors when they have certain needs. Yet at the same time, Care Corner has also developed our own online mental health buddy, Carrie, where locally curated content are available for the young people who want to search for help online. Some of them are comfortable talking to trusted teachers and counselors, while others may prefer to seek help within the community setting, slightly further away from people who know them. And our online platforms serve as a way to empower them, because they can book an appointment with professionals through the online portal to clarify their mental health inquiries and to screen them and help them better understand their mental health state. Having this rapport then allows us to work with the teens to encourage them to go back to their parents and also work together with the school in order to attend to their mental health needs. So this is the approach that we take.
Oh, Ms. Poh, both of you have multi-pronged strategies to deal with this. You will need to train people for this, so new people, and then the existing teachers, for example, you want a teacher to also offer, you were saying, some kind of counseling. And sensitivities have changed over the years. From the time I was a student to now, things have changed a lot. So you have to upskill existing teachers, teach new teachers. Do we have that kind of training available? Do you see that kind of resources?
We do have such training ongoing by social service agency. So for example, like Silver Ribbon, we have been conducting workshops for teachers, school counselors, social workers to provide support for the different target audience, including youth. And for youth, we have peer support program so that the peers can provide support to each other.
Well, thanks so much, both of you, for joining us this evening. Portia Poh from Silver Ribbon Singapore and Joseph Yeo from Care Corner Singapore.